Well, we want to start quite promptly today because we've got quite a busy schedule. Welcome to everybody. My name is Janet Gunn. I'm a trustee of the BEARR Trust. I had a career in international relations, but now I mostly do volunteering work. Well, a big welcome, especially to our four speakers today. We have Khadija Abisheva from Kazakhstan, but currently in California. We have Dina Musina from Moscow, Valentina Chupik, who's from Uzbekistan, currently in Moscow, and Daniel Kashnitsky, also in Moscow. Our topic today is migrant workers and civil society during the pandemic. And we're going to cover quite a lot of ground, mostly focusing on migrant labor in Russia and the problems that challenge them, from legal problems, trafficking issues, health issues, and so on. And 3 out of our 4 speakers are from civil society organizations themselves. I'll introduce each of them in turn before they speak. I also want to thank our interpreter, Irina, who will be helping anybody between English and Russian as required. I should also mention we're going to record the meeting so that anybody who misses it will be able to see it on our website later. Now I would like to ask Nicola Ramsden, our chairman, to say just a few words of welcome herself.
Well, good afternoon, everybody, and thank you very much for joining us today. And thank you to everyone who has donated to BEARR as well. This is the second of the webinars that we're running to replace our usual annual conference in November. Last week, we talked about disability, and if you missed that, or if you would like to hear it again, we will have it on our website, bearr.org. Please join us again next week, next Thursday, when the third and final webinar will talk about some of the lessons learned by CSOs during this pandemic.
Right, we're ready to start now. All of our speakers have presentations and we'll be sharing their screens with you. Khadija Abisheva, our first speaker, is chair of the board at the Legal Center for Women's Initiatives, Sana Sizin, in Kazakhstan. She's been there since 2003. It provides legal assistance and access to justice for victims of trafficking in human beings and migrants. Khadija has an MBA from the US in the field of not-for-profit organizations and is currently studying for accreditation as a paralegal in San Diego.
Thank you, Janet.
Thank you, Janet. Since I was allowed to speak in Russian and we will have interpretation, I will be telling you about the measures that were taken by our organization in such unprecedented times, the unusual times that we are all experiencing today. We've got certain statistics on that we collected in Kazakhstan over the period of the pandemic. And even though all of us stayed locked at home, we still continued to operate remotely from homes. Lockdown was announced in Kazakhstan and people could not even leave their homes because of the restrictions. So we stayed at home, but since there were issues and human trafficking victims are there, migration issues are there, and we continued to work. So we offered trainings for lawyers and legal experts in 11 regions of Kazakhstan. We spoke about security and protection of human rights defenders, protection of the rights and freedoms of victims of trafficking in human beings, assistance to children victims of sexual exploitation, legal assistance to victims of trafficking in persons with the framework of the state social order. We had several summer camps for 25 volunteers. We broadcast social videos on anti-trafficking in the public transportation, even though in some cities public transportation did not operate. We developed or designed certain awareness-raising materials. As for the statistics, so in this slide, you can see the statistics for major cities in our country where our lawyers and legal experts operate to fight THB. It's Shymkent, Almaty, Nur-Sultan, which is the capital city today, Termintau, Taraz, Aktobe, Kostanau, Kyzyl, Ust-Kamenogorsk, Aktau, and Petropavlovsk. And here you can see the number of COVID-infected patients by regions. Gender correlation. Again, I would not be reading the entire diagram, but you will see that the majority of trafficking victims are men, but also we have certain numbers of women and children, and you can see the breakdown by countries. Types of exploitation of THB trafficking. Mostly it's labor exploitation, sexual exploitation, labor plus sexual exploitation, 2 cases, and forced begging, 1 case. 1 case does not mean that we only had 1 victim and we don't have this issue at all. The problem is that very few such cases become known, become reported to the human rights defenders or law enforcement. So only 2 cases were investigated, 2 cases are pending, and 2 cases are currently being investigated. So the statistics on convictions is very poor. Even if cases are investigated, they do not go to court as a rule. So here you can see various stages of the cases, and the reasons are various. Sometimes the law enforcement authorities do not know how to do that, and sometimes judges are not quite competent in adjudicating such cases. Migrant workers as hostages of COVID. Since we have various countries bordering on our nation, so we have a lot of problems with people who live in the south of Kazakhstan. Lots of migrants from Central Asia were stranded in Kazakhstan, and we had 400, 300 people staying on the border, and they could not go back home, and Kazakhstan did not allow them to return to their places of former residence. We started organizing certain visits to those camps, makeshift camps, even though there were certain actually precautions, and we registered all our cars. We got special permissions for our cars, because if you didn't have the permission, we were fined. And so we got some passes or permissions to go to those makeshift camps on the border to distribute water, food and hot meals, hygienic items, providing them with psychological counseling, because it was a very stressful situation to all of them. So they had to live in the open to live rough. And Uzbekistan also supported us from their part. and people had difficulty crossing the borders. There were certain skirmishes, people felt indignant, people protested, and they were desperate, I would say. Mobile legal aid during this stay at the border zone, foreign citizens had a lot of questions regarding their legal status and where to apply in case of violation of their rights. Here you can see what it all looked like. Here are members of the organization, and you can see how many people were staying in the open air to be let across the border and go to their homes. Thank you very much for your attention. This is my brief presentation. Should you have any questions or comments, I would be prepared and glad to answer them.
Thank you, Khadija. Thank you very much. Now our next speaker is Dina Musina, who is a development manager at the Civic Assistance Committee in Moscow, a regional public charitable organization for assistance to refugees and migrants. Dina studied in Moscow and at the University of Derby. She joined the Civic Assistance Committee in 2019. She is mostly in charge of grant writing and emergency aid campaigns, and also has a new project she's involved with. During the pandemic, she managed to secure funding for their humanitarian aid campaign. Well done, Dina. Off you go.
Okay, so hello everyone. Thank you so much. Thanks so much for having me here. I'm sincerely thrilled and delighted to speak today and share great results of our work as well. My presentation will be in English. So let me tell you a little bit about our organization. So the Civic Assistance Committee is the oldest and the largest Russian NGO assisting refugees and migrants. We've been working in this field for 30 years already, and we've been an implementing partner of the United Nations Refugee Agency as of 1998. So for more than 20 years already. We are not only a human rights organization, but we are also a charitable organization. This is a very rare, one of the rarest examples, I think, of a charitable and a human rights organization. So we provide our beneficiaries with any kind of assistance, including legal assistance, medical assistance, humanitarian, psychological, medical. We have integration courses. So any kind of help that people in need might need, because vulnerable people do not have support from the government, from the state, asylum seekers and migrants with precarious legal status, they don't have that. When the coronavirus pandemic started, the quarantine started in Moscow in the middle of March, and we realized that we needed to do something really quickly. So we decided just to adjust our fundraising strategy and raise additional amount of money for our emergency relief fund. In order to do that, we decided to strengthen cooperation and communication with our existing private donors, because we have a community of supporters who mostly reach out to us through our social media. We have supporters on Facebook and Instagram. So we decided to start crowdfunding campaigns, and we targeted our individual donors through personalized email, newsletters, as well as social media publications. And we managed year to date to raise thrice as much from our individual supporters compared to the last year, to the whole year. So that was really a breakthrough in our crowdfunding. We think that our people have become more compassionate during the pandemic, just because this common, let's say, evil obstacle that we've been facing for 8 months now, just united our people, our supporters, our team, everyone, and people have been more compassionate during that time. So we started a crowdfunding campaign on our website. We decided to go big and launched another campaign on Global Giving. It is similar to the British Just Giving platform. So Global Giving is an international platform where we launched our first campaign in English, and that has been quite successful. We raised more than $5,000 in less than 2 weeks. So people support us internationally, and we were really delighted to see that result. And also what we did, we decided to approach our existing donors, which are big international private foundations, international organizations, etc. And we just asked them to help us secure some funding for our emergency relief fund. And to our surprise, 2 donors donated a very significant amount of money just instantly. And that's why we had funds to begin our humanitarian aid campaign in the middle of March. Yes. And we also participated in open calls of various organizations of the European Commission. We managed to secure funding with them for our humanitarian aid campaign. We also secured funding from Vladimir Potanin Foundation and other donors. That's been really successful, and we could not foresee that kind of results when we started all that work. So thanks to one of our donors, and that was our new project, we were able to rent our distance reception center. So we purchased laptops, mobile phones for our staff members, and we managed to arrange online tools, secure cloud folders to store all sensitive information of our beneficiaries. And that's been very successful, although in the middle of June, the lockdown was lifted in Moscow, and we started actually started our offline work while maintaining social distance. That's what you can see on the picture. Still, we use these distance reception tools, and it helps us tremendously, because during the pandemic, our workload has increased significantly, and we work 24/7. We have the same number of team members, but we have new projects, new funding, our beneficiaries have new needs, and we have to work more efficiently for long hours under pressure to make it possible. So we've been able to provide legal advice and other types of counseling, even medical assistance remotely. We just provided our beneficiaries for consultation and then redirect to medical facilities, for example. So that was feasible even during the lockdown. And of course, we still carry out, but not that extensively anymore. We managed to help thousands of people. You can see some figures here. Mostly they were refugees, but also labor migrants, stateless people, and Russian citizens who are primarily our beneficiaries who were previously stateless, or refugees who've managed to receive a Russian citizenship here. And this is a picture of our asylum seekers. They are not asylum seekers anymore. This family actually received a legal status in Russia, a temporary asylum for 1 year. Still, that was a big achievement for us, and that's how we distributed our aid. We ordered everything online. We contracted a wholesale with a card just to ensure safe delivery and to make sure that our beneficiaries receive all kind of groceries required to sustain their lives. We also provided monetary allowances for rent, because refugees and migrants just lost their jobs. They had some precarious jobs, and they mostly worked in markets, in small private grocery stores. So they lost their jobs, and even when lockdown was lifted, they did not get back to work just because markets were still closed. We prevented our beneficiaries from being evicted from their houses. That's been really that paid off, and we are also grateful to our supporters, to our donors for making that possible. You can see here 2 families from Pakistan as well. And together with our partners, with the UNHCR and with another implementing partner of the UNHCR, we also raised some for children, because still children go to school offline in Russia from the 1st till the 5th grade, and elder children study remotely, but still our children need that kind of supplies. During this campaign, we also sustained our legal assistance, and more than 100 people from the beginning of the year received a legal status in Russia. That is either a temporary asylum or a refugee status. Some stateless people received also a Russian citizenship, because unfortunately Russia still has a big challenge in terms of the Soviet Union. Loads of people just traveled across around the world, and when they returned to their home here to Russia, they realized that they just did not, they'd never had a Russian passport, and they ended up being stateless. So we tried to influence that through our legal assistance as well, which we implement together with Memorial Human Rights Center. It's also a long-standing, very established human rights organization in Russia. So that's how we manage this pandemic, and still our beneficiaries request that kind of assistance, but not as extensive as it initially was in the beginning of the pandemic. We also managed to create an endowment foundation during the pandemic, because we believe that an organization, especially a non-profit, shall be sustainable, and that tool will allow us to depend less on big foundation grants. And of course, maybe some of you know that working in Russia is not really easy. Some of our donors were listed as undesirable organizations in Russia, and their work here stopped, so they could not longer sponsor us. That is why we always need to keep in mind that our sustainability is really crucial in case we want to continue our human rights and charitable work. So I guess that's in the end of our conference. Thank you.
Thank you very much, Dina. It's, congratulations on your success.
Thank you so much. Thanks so much. That's really impressive. Thanks.
Thank you. That's great. Thank you very much. And next we have another speaker from Moscow, but Valentina Chupik. She actually is from Uzbekistan, and she's an independent legal professional specializing in human rights. She's been executive director at the not-for-profit organization Tong Jahoni for 15 years. The organization was established in 2005 by citizens of Azerbaijan, Armenia, Georgia, Kazakhstan, Russia, and Uzbekistan to provide free legal and social assistance to migrants. Valentina has a PhD in migration law from St. Petersburg, and her master's was on ethnopsychology and social psychology. Valentina, we look forward to hearing from you.
Добрый вечер. Меня слышно?
Good afternoon. Can you hear me? Okay, great. Thank you. I will tell you about this year, this coronavirus year, compared to the previous year, to 2019. I will be comparing these 2 years because we are still suffering from the pandemic, and I will be focusing on major challenges and on the most challenging months, that is April, late March, April, and May. So, since the beginning of the year, we had 49,700 plus applications. Compared to the similar period of this year, we only had 36 plus thousand applications. And that's the growth, even though we have many, much fewer or migrants in Russia. And we have difficulty coping with this number of applications. The most terrible day was on the 16th of April when I had 1,100 applications. So if we compare the nature of applications last year and this year, blue are last year and red are this year, from the 1st of November last year till the 31st of October this year. So you can see that the number of illegal police detentions has increased by 2.5 times. On the 15th of April, 61,000 migrants were detained on Moscow Metro, and 1,300 contacted us and reported those detentions of 9,000 people. None of them were detained legally or lawfully. All of them had the permits, the passes, but the system that allows to check those passes did not operate. And perhaps the police officers were actually extorting bribes. We received more than 7,000 applications and complaints about extortion of bribes by the police officers. More than 700 were filed prior to the 26th of April. So many such complaints were about the direct extortion of bribes, that more than 7,000. This year, Decree 274 by the Russian president was issued to ban expulsion of foreign citizens. Deportations, extraditions were also banned for a certain time. This decree was prolonged several times. But nonetheless, we have the practices of expulsions. It's fewer than last year, but you should remember that all those expulsions are illegal or refoulements. So this year, the number of illegal home invasion or home entry by the police has grown tenfold. The police officers will just break into the homes of migrants in the period from mid-April till mid-May. There were 129 such entries. So they entered under the pretext of the migrants violating the self-isolation regime. So people stay in the comfort of their homes, then the police officers break into their homes, they throw them down, they sometimes beat them, they rob them, they are robbed of money and some valuables, and all of that under the pretext of their violating the self-isolation regime. Just this year, the number of ungrounded violence against migrants has grown eightfold, from 36 to 2001. There were direct robberies or of migrants, particularly during those illegal entries or invasions into homes. 71 such robbery occurred in their homes during the illegal searches. They took all valuables and money just because they wanted to do so. They took paintings, they took gold, they took the money. And the number of seizure of passports by the police have also increased, just for the migrant to pay fines or to bring the money as a bribe. So this year, it has become very popular to issue fake tickets for bribes or for fines. This year, the number of falsification of administrative cases has doubled. And this growth is observed today, just as we are speaking. Every migrant who asks the police officer why they stopped them to check their IDs will get the protocol according to Article 111.3, just violating the request or disobeying the request of the police officers. And only 1/4 of those administrative cases will be closed as ungrounded. And we failed to have 3/4 of those cases closed, particularly when it comes to the administrative arrest, because if the police recognize that the administrative arrest was illegal or illegitimate, they will have to pay moral damage, and they don't want to do so. Then criminal cases are falsified on the pretext that migrants use fake documents. So today I had to deal with the Uzbekistan national who was apprehended on the tube with allegedly fake document. He has just arrived today. He went to the tube and he was stopped by the police officer under the pretext that his documents are fake. I spoke to the police officer and to the migration service official back in Uzbekistan, and she said she was ready to send the confirmation of his IDs, but our police officers would not accept those confirmations. Oftentimes, migrants are denied issuance of documents, particularly in late March, early April, when even though it was allowed to issue documents to them, irrespective of the purpose of their stay, and even though they outstayed the allowed term. Nonetheless, the Migration Service would deny such prolongation of the documents. And the second wave was from August to September. Any applications for the documentation were denied. So people were waiting whether the regime of migration privileges will be prolonged. So we also observed a 100-fold growth in illegal refusal to provide medical or refusals to provide medical assistance, particularly when it comes to hospitalizations with COVID-19. Now the number of cases when salaries and wages are withheld is less than in June and July. But in June and July, we observed this withholding of salaries and wages. Now we see a peak in applications for humanitarian aid, and we are not supposed to provide such aid, but we still are forced to do so because we see that lots of people are in need. And we provide consultations on migration law, and now the number of such consultations has reduced because the migrants who might seek such consultations have not come to Russia because of the closed borders. Next slide, please. It all started from airports. On March the 18th, Russia completely closed entry for foreigners. So airlines canceled all flights, and they decided that the outgoing flights should be blocked as well. I returned from the business trip in March, and I saw that people were just lying in the halls of or in the waiting halls of the airports. And what I had, I just got the money and I bought some food and I took it to the airport, to the Sheremetyevo airport. But it turned out that they were living there in various airports, in Domodedovo, in Vnukovo, etc. So a whole network of volunteers helped us to provide assistance to those people. And then donors actually provided the money, even though we didn't seek any support from the donors. But donors understood that it was a very acute need, and we had more than 1,800 one-a-day packages of food. And more than 18,000 migrants were stuck in airports, and they stayed there till March the 31st, and then they were ordered to leave the premises of the airport. The next slide, please. Then mass illegal detention started. You can see how people were kept in custody during coronavirus pandemic. Here you can see how people were detained on the tube in Moscow metro, and you can see the police station in Kharkovsky with 104 migrants and only one officer on duty. They stayed there for 7 hours, and then they were let go. And here you can see how migrants were left to stay in a police station for a night, and they had to sleep on the floor. And then it's the metro station, and the police officers just detain all the janitors in the area, and just all of them. And the the service provider came to us saying that their employees were detained. People stayed on the floor with no access to toilet, without access to water. Some people just fainted. 2 days ago, we had a case in this town of Vidnaya where the police officers detained 18 migrants in our supermarket. They brought them to the police station. They kept them in custody for 24 hours, and then they took them to the city court, and they stayed there till almost 9 p.m. And then one of the migrants started vomiting because of a hunger, and the other had a heart attack. And they then called me, not any earlier, and I called the ambulance, and 4 were let go, and others actually stayed there. And then we next slide, please. Then we contacted the Tajik consulate, and they helped them. Illegal home entry with the use of force to detect violations of self-isolation. In the first picture, you can see how they break into the dormitory in Nizhegorodsky Street. Janitors live there, and they are totally legal migrants. They live there because they are registered there. Those premises were given to them by their employer. They reside there legally and legitimately, and you can see that they are totally surprised. They don't know what to do. And here you can see a witness in one of the police station. He was beaten, and he said, I cannot go with you because I've got COVID-19. I cannot come with you. So they beat him and he had a concoction. Now you can see the Armenian national who was beaten by the police officers, and she's got bruises all over her body. And here you can see the Kyrgyz national who is being dragged by the police officers. So I can tell you that some police stations have extremely aggressive personnel. We had 174 cases of illegal entry, and in 88 cases, people were beaten. In 54 cases, they were robbed in the process of such illegal entry. Their personal belongings were taken away from them. And when we complained, they said that nothing happened. And there was one painter, and the police officer said, next slide, please, that we will let you go if you let us, if you give us your paintings. The next problem was that starting with late March, but more commonly since mid-April, migrants who had contact with COVID-19 patients were locked in their dormitories with the average residence of 200 to 600 people. They were locked from the outside. They didn't have any food. In 2 cases, water supply and electricity were cut off. Nobody wanted to support them. Nobody wanted to actually provide any assistance to them. And when donors started giving us some money, we started buying food and bringing this food to such dormitories on a daily basis. We were bringing water to those dormitories for 3 days. And then we fought with the utility companies to restore the water supply. They didn't have any chance of getting medical aid. And they said that even if you were not the COVID patient, you would be infected just because we couldn't socially distance, we couldn't have any medicines, we couldn't have any PPEs, and we were forced to stay in the same rooms with people who had either contacts or were patients. Next slide, please. And here you can see us distributing humanitarian aid just to families who were isolated, and the bottom pictures are the dormitories, one in Nabiretsky Labirezhny, and one in another street. We got from 4 donors. Actually, we didn't even ask for this assistance. We didn't know about those donors, but they contacted us and they gave us 2.5 million rubles, and we distributed packages, food packages to migrants from 22 countries, and they sent both money and packages, and they also referred some volunteers to us. We worked with 31 volunteers who assisted us. Next slide. During this very period, we registered lots of denials of emergency medical aid. People were not hospitalized, and even if they were left in the corridors. People with non-COVID diagnosis had no assistance whatsoever. You can see that people were injured, but they did not get any assistance. Besides, some migrants under threat of dismissal were forcibly administered the COVID vaccine, and when people died for various reasons, their bodies were not given to their parents. Next slide, please. Over this time, we sent 289 bodies to their respective countries. You know that there are 14 migration statuses in Russia, and over the period of the lockdown and after that, denials were common in respect of all those statuses. Next slide, please. And what we are facing on a daily basis is the check of mask regime, Russian style. I'm never asked to wear masks or gloves when I'm on the tube or in the metro. But if you have non-Slavic looks, then you will be fined for violation of mask regime. And you can see the police officer who doesn't wear a mask beats a person with the face mask but without gloves. And the next slide shows, and the next picture shows that the police officers do not wear masks properly, and they actually draw protocols for a woman who is in a mask. He says, I apologize, but we have a plan of certain detentions of people who do not wear masks. Next slide, please. So conclusions. Migrants in Russia are victims to discrimination at the level of law and law enforcement practice. Formal grounds for discrimination against migrants are just registration or lack thereof. Discrimination against migrants in Russia at all levels is based not on citizenship or lack thereof, but on race and ethnicity. And we can see that even in the law, when certain privileges are given to nationals of Belarus, Moldova, and Moldova. For Russian authorities, corruption and personal gain are much stronger motives than the law or even presidential decrees. And discrimination against migrants in Russia is motivated by corruption, not by ideology. So this is it. Thank you.
Thank you, Valentina. This was a very grim picture you painted, and extraordinary numbers of people who came to help to your organization. Quite amazing. Thank you very much. Now we will move on to Daniel Kashnitsky, researcher at the Higher School of Economics in Moscow, working on directions of labor migration and HIV positive migrants living in Russia. He's academic relations coordinator at the regional expert group on migration and health in Eastern Europe and Central Asia. He has a master's in public health from Lund University in Sweden, and has also studied NGO project management and capacity development at the Higher School of Economics. Daniel, off you go.
Yeah, I'm a junior researcher at the Higher School of Economics, and over the last 5 years, I've been doing research on the topic of migrants' health in Russia, mainly focusing on migrants from Central Asian countries, labor migrants from Central Asia, and living and working in Moscow. And we started with a large qualitative study in Moscow to investigate migrants' infrastructure. Basically, we were the first ones among the Russian researchers to try to answer the questions how migrants settle, how they live, how they work, and how they spend their spare time in Moscow. And here the topic of the theme of health emerged. And so we went bottom up, and we identified that migrants, they don't like to talk about their health, basically. They assume themselves to be healthy. And well, the short answer is, well, I'm healthy. And if anything happens to my health, so basically I know a phone number where I will seek health care. But basically they were very, very brief in explaining. So then we, after investigating migrants' infrastructure in the city of Moscow, we wanted to understand how migrants' access to healthcare is structured in Russia. And we identified barriers and a formal and informal strategy of access. So basically, speaking about the barriers in access to healthcare, well, the main barrier is migrants' health insurance, as we call it. Basically, we have two types of health insurance in Russia. The official one, the state health insurance, which is in some cases accessible to international migrants coming from the countries of Eurasian Economic Union, if they have a formal contract with the employer. So for the rest of migrants from countries such as Tajikistan, Uzbekistan, Moldova, and Ukraine, so basically they have no viable option for access to planned care. So migrants, anyone in Russia, a refugee, a stateless person, an undocumented migrant, is only granted with emergency health care, well, which is defined as health care in a situation of a threat to life. So if you have a leg fracture or if you have anything urgent, then you will be granted medical intervention. For any planned health care, you need to have this medical insurance. And most of the health insurance which are provided by private insurance foundations, they're barely, they are, I can say they are symbolic because they grant the same amount of services as the emergency healthcare. So basically, migrants they have to purchase this private health insurance in order to be able to apply for their residence permit. But basically, they receive no quality in return. So it's one of the requirements, basically. And well, this is can you go to the next slide, please, Louise? Yeah, so on this, yeah, because we have an international audience, I wanted to show the map of Central Asian countries. So in you can see in the red figures, they indicate the number of migrants from Uzbekistan, Kyrgyzstan, Tajikistan, and Kazakhstan currently residing in Russia. So in Russia, 4,600,000 people. This is the estimated number of migrants from Central Asia before COVID. So if you take the larger Moscow, the agglomeration of Moscow, this is over 1 million people. So basically, we can talk about large number of people, and the estimated number of undocumented migrants in Russia is over 2 million people. And the black numbers, this is the comparison of GNP per capita in Russia and in countries of Central Asia. So only Kazakhstan can be compared to Russia. This is the second receiving country, and Uzbekistan, Kyrgyzstan, and Tajikistan, they are the donor countries, the sending countries. This is just a small background, statistical background. So next slide, please. So basically in the post-Soviet country in Central Asia and Eastern Europe, we have a visa-free regime for traveling. You can, from any country of EECCA countries, you can travel to Russia and reside for up to 3 months. And then you need to legalize your residence in a way or another. And here comes the problem. Well, a large share of migrants, they come from villages or rural suburbs in the countries of in the sending countries, and 20% of Central Asian migrants are females, and their share keeps growing. Well, the Russian language is not such a huge barrier, because the main donor countries of migration are former USSR countries where Russian is widely spoken. But migrants coming from rural areas, they have to acquire their language skills when they come to the cities of Russia as labor migrants. So next slide, please. So here you can see a look over Moscow. This is how the city is structured, and migrants, they live in all districts of Moscow. Basically, in the districts where they work, they tend to live where they work, and they're widespread all across the city. And so Moscow still keeps this social structure of the city without prominent rich and poor districts. Next slide, please. So I already talked about no access to health insurance to a real health insurance that would guarantee planned health care. This is the largest barrier. And low awareness on affordable healthcare facilities in Moscow, another important barrier. Discrimination in state clinics, but Valentina talked a lot about discrimination, so you can imagine. Failure to comply with labor rights. It is hard to sign an official contract with your employer, so which prevents you from accessing illegal status in most of the cases. And of course, extra burden on female migrants, especially during pregnancy. Before 2010, all foreign citizens had access to free antenatal care in Russia, but then it stopped. And now you have to pay for antenatal care. But delivery is still free of charge in Russia, although a lot of violation during registration of the baby occur. Next slide, please. So these are the coping strategies. Well, the first one is the most common one, the healthy migrant strategy. You basically believe yourself to be a healthy migrant, and it does not mean that you're healthy, but you postpone treatment to the moment when you're back in your country. Or you have the so-called Skype doctors who give you brief consultations, or the pharmacist who basically helps you to navigate across the cheapest medicines to alleviate your pain. So these are the healthcare tools available to most migrants. Basic emergency care, I talked about it before, so it is available. Ambulance is available beyond the cases of open discrimination. And private outpatient clinics are available for migrants. I should mention a so-called Kyrgyz clinics, which are the private clinics in Moscow, about 30 of them. And these are official clinics. This is not ethnic medicine, but the doctors speak the native tongues of migrants, and they understand the social economic they understand the social determinants of health of migrants, and they don't prescribe expensive medicines, and they work longer hours because they understand migrants very often cannot come to see the doctor in the daytime. So they adapt to migrants' lives and life conditions in migration. And of course, the fourth strategy is leave in Russia is in case of severe traumatism, in case of chronic diseases, in case of tuberculosis, HIV, and STIs, if you're not granted a residence permit because for the reasons of having one of those. Next slide, please. So now I will spend the next 5 minutes talking about HIV positive migrants. They all by default fall into the category of irregular migrants, because if you have HIV, you are not granted a permission to reside in the country according to the law 38, of the federal law 38. And receiving a prescription to it's called undesirable stay, a prescription to leave the country, or we call it soft deportation because deportation is expensive and it is very rarely enacted. So we can talk about putting migrants into illegality, but if they leave the country, they will never return back, because HIV is such a disease which is currently cannot be cured completely. It is basically not a disease, it's a chronic condition. If you receive antiretroviral treatment after 3 months of use, so your viral load is undetected. And even during unprotected sex, you don't transmit the virus and you feel well, so you can be deemed as a healthy migrant. But the Russian authorities, they don't buy into this idea for the moment, and all international migrants residing in Russia are undocumented. And next slide, please. Those HIV positive migrants who were tested before coming to Russia and who had been receiving HIV care from their home countries, they continue receiving ART while they reside in Russia. If they send their test results every 3 months, they can get the next portion of their ART via their friends or relatives from their AIDS doctor from back home. This is very important, but those migrants who were tested positively in Russia, they don't have this option because they are not registered. They are not registered as HIV positive with the health authorities of their home country. This is important, and because of stigma and discrimination, they don't disclose their most often they don't disclose their status to their friends and relatives, and they have expectations to be breadwinners. So this is why they keep residing in Russia and sending remittances to their families. And well, then it depends on your health. It's either 2-3 years or up to 10 years when your immune status keeps going down, unless you start receiving ART. Some lucky migrants, they have support from other HIV positive people or from civil society organizations in Russia, but this is a drop in the sea. So most migrants, they don't have support of NGOs in Russia. And the problem of deportation prison, it stands alone because Valentina mentioned about that some migrants, they spend months before deportation in special deportation centers, and so ART is not provided to migrants who have been residing there. Next slide, please. So what happened during COVID? So on the one hand, the negative effects of COVID, it seriously affected the transnational chains of solidarity in access to healthcare. As I mentioned, the provision of ART to those migrants who are registered back home with the aid centers. So it got interrupted for a lot of people, and those people who were ready to return home and to start treatment, they could not travel back. So this is why COVID affected their ability to make this decision in favor of starting their treatment. And what was partially positive because of COVID, this undesirable stay, which is prescribed to migrants with HIV, this self-deportation, it is currently suspended because it's not applied to international migrants. This is a sort of temporary amnesty to undocumented migrants. It's been first enacted for 3 months, and then postponed to extended to another 3 months and then to another 3 months, and we expect we hope it will be postponed to another 3 months. So basically, we can say that deportation is really going down now. It's not enacted in most of the cases. I'm saying it accurately because Valentina, she mentioned that in some cases there were cases of deportation. And so COVID treatment itself, it is considered as emergency care. And we have a lot of examples when international migrants and both documented and undocumented, they received COVID care in the hospitals of Russia. So in a way or another, this is a good advocacy example and good practice to show the Russian healthcare officials that that healthcare is not only a human right, but it is also an important prerequisite of the health of all population residing in Russia. Next slide, please. So solutions by the civil society in Russia. A foundation, a very close friend of mine, a foundation called Shagi, Steps Foundation, they opened an online COVID clinic for migrants. Most of their requests are related to interrupted antiretroviral treatment. So basically their online service is extended because of that, and the coverage of services provided went up. So some new projects designed for migrants are currently emerging in Russia by MSF, the Elton John Foundation. So they are mainly designed for key populations such as sex workers and transgender people, LGBT migrants. But it is still very important that they're on the rise, and international donors, they understand the necessity to fund such projects. And we are hopeful that Russian authorities will follow this example. So, and I have to stress that solutions for pregnant women must be urgently available, as it used to be before. Yeah, I think I should stop here, and I will be happy to answer questions. Thank you very much.
Thank you, Daniel. Thank you very much. This was absolutely fascinating.